Okay, Susan, so we have updated your checkup pictures for today. I'm going to have Dr. Bob come in and check a couple of the spots. We do have to talk about the root canal on your bottom right. There's also a cavity on the top right, and we're also going to check in between your upper left teeth. In between the teeth, there seems to be a cavity on your x-ray, okay? I think you're doing a great job brushing. We just need to increase your flossing up to twice a day just to improve your oral health and get some of that inflammation in between your teeth a little better, okay? So I'm going to have Dr. Bob come in and we'll see what he says, okay?
Okay, thanks, Kat.
So Susan, Dr. Bob is going to be coming in, checking your checkup x-rays, talk about that root canal and a crown we were talking about, and he's also going to check a couple of those other areas that I found, okay? So he should be coming in shortly, and he should be right in.
Good timing.
Good timing.
Hey Susan, how are you?
Hi, Bob, how are you?
Good to see you again.
Yeah, you too.
What's happening? Good summer?
Oh, yeah, very
Let me
nice.
put that light off here. Good. How the kids doing?
Oh, great,
Jimmy?
great.
Yeah.
We're all busy
So busy with what?
with sports.
Sports as usual.
Yeah,
What's-
cottaging.
Cottaging. Trent's good?
Yes, fine.
How's your teeth? How's things? Teeth okay?
Oh, Kat said I have a couple areas of concern.
Okay. Like pain? Chewing?
I don't
biting?
have much pain, no.
Okay. So health's good?
Yes.
Everything's
yes,
good?
fine.
Can I put you back and have a
Yes.
look? Okay, great.
So the medical history is updated.
Okay.
Susan is actually doing a great job brushing. We do want to increase the flossing up to twice a day. There's a little bit of inflammation and bleeding in between the teeth.
Yeah.
Soft tissues are within normal limits. Cheeks, tongue, lips, everything is healthy. We did update 2 checkup pictures today. We have noticed the decay on the 4-7, which requires a root canal, and perhaps we can talk to Susan about a crown.
Okay.
And I've also found a little bit of marginal breakdown on the 1-7, and also if you can check 2-5 and 2-6 for me, it's starting to break down a little bit as well.
Great. So is that where it's bothering you, Susan? Lower?
Not too much, a little bit, not too much, so.
So is it kind of hot, cold, or just
Yes.
chewing? Okay.
Yes.
Any swelling you've ever had? Anything
No.
like ear pain?
No.
Anything?
No.
Okay, good. So let me just take a peek, Susan. I'd like to just put you back. I'm going to put the light on here.
And we've also taken an intraoral picture of that 4-7
Awesome.
for the insurance purposes in case Susan requires a crown.
Great. Okay, so let's just have a look around here. So, Kat, you just want to go over that again as far as what areas you were looking at with
So
Susan?
we're looking at the 2-5 DO and 2-6 DO. We
Okay.
do have some marginal breakdown on the x-ray.
All right.
And if you can also check for me 1-7 MO
Perfect.
and the 4-7, there's quite a large cavity on the x-ray as well.
All righty.
Like I mentioned, Susan's doing a great job brushing. We just need to increase the flossing.
Okay, yeah. Little inflammation, Susan, so you probably knew that anyway. We'll never stop asking you to floss. Close tight, Susan. Great. Open again. And I just want to feel around this lower tooth. Is that sore at all when I touch that? A little bit? Okay. And close up tight again. And open again. And Susan, I'm just going to put my light on here so I can have a look. Can you say, ah? Great. Tongue to the roof of the mouth. Super. Back down again. And we're just looking at your lips, tongue, cheeks, throat, making sure
we
there's...
also have Susan on the regular 3-month cleanings.
Awesome. Head towards me, Susan, just a little more there. Where everything looks healthy in there. I'm happy with that.
The only
Okay.
outstanding
And
treatment
yeah, Mark.
just from before was we were looking at a crown on that tooth at one point, just because it was such a large filling.
Okay.
But now that's actually the one bar that's
Okay.
gonna need a root
Perfect.
canal.
Okay, so let's put, Susan, I want to just set you up and I just want to spin you around and I just want to have a look at your x-rays, and Kat's taking a nice photograph here if we can just spin you around just to look. So we talked before about that, that back tooth. Can you see that? Is that okay? So we talked before about the back tooth, the one on your lower right, and that is the one that's causing you pain, and that's the one we talked about doing a crown. So at this point now, I think we're going to need to go one step further because it looks like there's some infection in the tooth. So what happens with infection in a tooth, it's something where the bacteria gets in either through a crack or a large cavity on it. It starts to get into where the nerve is. And what's happening in your case, the nerve is an infection is starting in there, and that's what we call an abscess. So the good news is it's a good strong tooth as far as the roots go, but we can go ahead and save this tooth, and we need to do 2 things. We need to go ahead and we need to do something called a root canal, which isn't a problem. We do it in one visit, start to finish. And when we're doing this kind of thing, Once we end up with a tooth that's had the root canal and everything heals, we need to think about something strong that's got a strong biting surface, because you can see on the photograph there, it's a very large filling, and now there's a break in the tooth where the cavity is. So to have something which has a very strong biting surface, hold the whole tooth together, your best option for something like it's a crown. So we can look into that, and Marnie's going to actually take that, find out where your insurances are and what that costs. The other option is we can do a very large filling. You don't get the same kind of strength. Or obviously, you know, the other option is you lose your tooth, which is hopefully something you don't want to do. But, you know, no, good. That's what we want to hear. Because everything else looks great. It's a really strong, functional, foundational tooth, so you really want to keep that. So we'll do everything we can to make sure that we don't lose the tooth. And I'm going to have Marnie take that now, and she's going to look at everything for you. She'll take it, she'll give an idea of what we need to do, because at this point we'll put you on an antibiotic first, settle the infection down so we can go ahead and treat the tooth, do the root canal. It's done here. There's no pain, one visit start to finish. I've had a couple done. It's surprisingly easy. So don't listen to the horror stories. So how's that sound?
Yes, I
Do
want
it.
to save my tooth.
Good,
Definitely.
good. Okay, so let's go ahead, Marnie. Could you set that up, and then what we'll do is she'll take you over there, and as soon as we can get going on that. And like I say, Marnie will look at everything for you.
Okay.
Sorry for the bad news. I hope it
Okay.
wasn't bad.
No.
You okay with
fine,
that?
thanks.
Okay, good to see you, Susan. We'll see you again.
Okay.
Take care. Bye-bye. Okay, now I'm going to talk. So what we just did there was, and Susan can listen to all this. She's good. I'm buying her dinner. So what we just did there is this. It's very important when we come in here to be prepared. So you can see how the team approach works. Kat has gone ahead and done a great job of telling Susan what she finds. She's written everything down for me on a tray. She's got a photograph on the screen. She also has, she has the x-rays up. So when I come in, another thing that happens behind the scenes is that I'm given a blue card, and this blue card in our office, what it does, it lets me know when I'm in another treatment room that Susan is ready for a check. It only comes when she's ready, but of course, I already know where Susan is in my schedule, because right now I just put some anesthetic in a patient, and I'm ready to come and do my check for Susan. So I already knew this, and the timing was good when we come in. So if you look at what transpires in here, it's very important for a couple of things. It's important that I reinforce the relationship when I come in here. Kat's already done that. When I come in with my support assistant, which was Marnie, I already know ahead of time. Marnie's prepped me as far as any of the personal relationship notes that we have on Susan. That's already been done ahead of time before we come in the room. I already know this. I know Susan. I remember a lot of it on my own, but in cases where I don't, when there's thousands of patients, Marnie's told me things about Susan. Just kind of key me back into where I need to go, because I want to come in first of all. If you notice, I want to sit, and I want to face Susan at eye level. I don't want to be standing over here. I want to shake her hand. I want to introduce myself again, and I want to make a personal touch. That's very important. We have eye-to-eye contact, so it's not just about coming in and looking at teeth. So I sit down here, and I want to form another touch or another bond with Susan, just to reinforce that trust. So the next thing we talk about very quickly into that is we start then to move into a point when we start talking about Susan and her teeth, if she's got any problems. So then Kat will then take over at that point, and she's going to introduce me to the things that she's found and Susan and her have talked about. And then as we go back, and then I'm looking as we go, and then Kat is actually continues to talk about three things. We do a three-line talk over. Susan had some work to talk about, but even if somebody had a perfect mouth, we need to talk about three things predominantly. We need to talk about something about their teeth, something about their gums, and something about their brushing, flossing habits. So it's what we call a three-line talk over. Now that's already been done by Kat. It's reinforced again to me when I'm looking at Susan. So Susan's hearing this again twice. So it's kind of a reinforcement that we care about their teeth, we care about their gums. So then what we do from there is when we go back and I'm actually doing the examination in the mouth, then Marnie may come in, and Marnie already knows outstanding treatment. She knows what insurance limits are. We need to know all of this information to facilitate Susan making a great decision, because obviously it's very important she knows where her benefits are, what the coverage is, what the cost is. So as we go in and do this, we immediately know how to kind of move Susan from what she's been told. I'm informed, we confirm it, then we can move right into doing something to help Susan out, which is she needs to get that looked at. We've showed her, we look. Showing a photograph on the screen with every patient is critical. Every patient we come in, even if it's a patient that doesn't have treatment, you should show them a wonderful photograph of how healthy their gums look. So very important visually to reinforce what we're doing with this. So so we've got the treatment team in here, which are Kat, and then the talk over that will occur with Marnie, and sometimes Kat will have actually a hygiene assistant. Now sometimes I'll come here, I won't even have Kat here. Kat will then have moved on, and then a hygiene assistant, who's Kat's full-time hygiene assistant, will then take over, and she will actually be very aware of the same 3-line talk room and the information that Kat has left for me to look at for Susan. So she's heard it a couple times now, and she needs to make an informed decision. So this is a thing now that as we're set up, and here's a really interesting thing, we already know what our schedule is. There could have been a possibility if Susan had a filling to do or something, or there may be time in the schedule to do it right now. So this is where you really want to maximize not only the treatment, but maximize Susan's time. If it works great for her, if we can get her in, we do it now. So this is something which you always want to look at. We're looking, number one, to always give the benefit for the patient. Now, if the benefit for the patient also works with us, even better. If we have an opening, we need to be aware of our schedule. We need to be aware of what Susan's schedule is. So on board, lots of times people will come in if they've got more minor work to do. We already know ahead of time if that can be accommodated for the treatment with the dentists that are here. Sometimes me as well, and we will actually be set up to say, Susan, would you like to do that right now? She's got a couple chips, she's got a whatever, and then so we'll actually put her right in the room. So this is a very interesting example of a few things. Number one, we need to make sure that Susan's here on time, that I'm checking on time, that I come in here and Susan's very informed of what she needs. We need to be informed of what's important to Susan, the choices that she makes, and her insurance coverage for this kind of thing, or what her obligations are financially. So everything occurs very quickly, very seamlessly. So we get in, Susan doesn't sit in here any longer than she requires, and then she actually moves on to get any treatment that she needs done. So that's the whole nature of what these talkovers are and what the hygiene check should be. And if you'll notice, when I came in, it was probably 3 minutes. So that's what it was. Thanks, Susan. Now she doesn't want to come back here anymore because she didn't know this was all happening. So anyway, that's good. Okay.